You've had a night out, the drinks were flowing, and you think you'll just sink into a deep sleep. Alcohol might feel like a ticket to dreamland, but what really happens inside your brain once the lights go out? Tonight, we uncover the shocking truth about alcohol's impact on your sleep. Think that nightcap helps you doze off? Think again. Stay with us and prepare to have your beliefs shattered. While some individuals consume alcohol as a means to induce sleep, its effects on sleep quality are far from beneficial. Although it might induce drowsiness initially, consuming alcohol before bedtime can lead to a night characterized by disrupted and restless sleep. Recent studies have further illuminated the reasons behind this phenomenon. Notably, Dr. Aristidis Iatridis, an esteemed pulmonologist and sleep medicine specialist at Piedmont, points out that alcohol can interfere with the release of melatonin in the brain. Melatonin is a crucial hormone responsible for regulating our sleep-wake cycle. Under normal conditions, as night approaches, the brain increases melatonin production, signaling to the body that it's time to prepare for sleep. Alcohol's interference with this natural mechanism can significantly disrupt one's sleep pattern. Furthering this understanding, research has also shown that alcohol can decrease the proportion of rapid eye movement, REM, sleep, a critical stage of the sleep cycle associated with dreaming in deep, restorative sleep. Reduced REM sleep can lead to cognitive issues, mood disturbances, and a feeling of fatigue upon waking, even after a full night's sleep. This might explain why individuals who drink alcohol before bedtime often wake up feeling more tired and less refreshed. Moreover, alcohol is known to relax the muscles of the throat, which can increase the risk of snoring and sleep apnea, a potentially dangerous sleep disorder characterized by pauses in breathing during sleep. Chronic disruptions from sleep apnea can lead to increased daytime sleepiness, reduced cognitive function, and long-term health risks such as hypertension, cardiovascular disease, and stroke. While the immediate sedative effects of alcohol might seem appealing as a sleep aid, the broader consequences on sleep quality and overall health make it a less than ideal choice. Instead, adopting good sleep hygiene practices and addressing underlying issues that may be causing sleep disturbances is a more sustainable and healthier approach to achieving restful sleep. Problems with consuming alcohol before bedtime. 1. Insomnia. One of the primary concerns with alcohol consumption before sleep is its potential to cause insomnia. While alcohol can make you drowsy initially, it often results in fragmented sleep. After the initial sedative effect wears off, many people experience wakefulness and find it challenging to drift back into slumber. 2. Disturbance in REM sleep. Alcohol can significantly reduce the duration and quality of REM sleep, the stage in which we experience our most vivid dreams. Dr. Iatridis highlights, REM sleep is the deepest, most restorative phase of our sleep cycle. Yet, alcohol consumption can decrease the time we spend in this critical stage, leading to feelings of fatigue upon waking, even if one has slept for a full night. 3. Exacerbation of sleep apnea. Sleep apnea, characterized by interruptions in breathing during sleep, can be aggravated by alcohol consumption. Dr. Iatridis explains the mechanics behind it. The airway passage, stretching from the voice box to the back of the throat, relies on muscle tension to stay open. During sleep, these muscles naturally relax. In certain individuals, this relaxation is so profound that it results in airway obstruction, causing them to wake up choking. Alcohol, being a muscle relaxant, can exacerbate this issue, making the episodes more frequent and severe. Guidelines for alcohol consumption before bed. To ensure restful sleep, Dr. Iatridis suggests ceasing alcohol consumption at least 4 hours before bedtime. He notes, while many don't adhere to this guideline, it's the optimal approach to prevent sleep disturbances. Additional problems with alcohol before bed. Dehydration and bathroom breaks. Alcohol is a diuretic, which means it encourages the body to lose fluids. This can lead to dehydration, causing you to wake up thirsty and disrupting your sleep with multiple trips to the bathroom throughout the night. Temperature dysregulation. Alcohol can also affect your body's ability to regulate its temperature. While you might feel warm initially after drinking, Alcohol can lead to a subsequent drop in body temperature. This can further interfere with your sleep, causing you to wake up cold in the middle of the night. Worsening anxiety and mood disorders. For people with pre-existing mental health issues, like anxiety or depression, alcohol can exacerbate symptoms. Since sleep is essential for mental well-being, disrupting it with alcohol can create a vicious cycle of poor sleep and heightened symptoms. Drug interactions. Alcohol can interact with medications, including sleep aids, antihistamines, and some antidepressants, often amplifying their effects or creating new side effects that can impair sleep quality. Long-term health risks. Habitual drinking before bed, apart from the immediate sleep issues, can lead to long-term health concerns. These can include liver disease, digestive problems, and an increased risk of chronic insomnia. More guidelines for alcohol consumption before bed. Mind the clock. Dr. Iatridis emphasizes that you should have your last drink at least 4 hours before bed. This will allow the liver enough time to metabolize the alcohol, reducing its negative impact on sleep. Quality over quantity. Opt for lower alcohol drinks if you must have a drink. Beverages with a lower alcohol content are metabolized more quickly, reducing the chances of sleep disruption. Alternative solutions. Instead of relying on alcohol as a sleep aid, consider other proven methods for improving sleep. These include establishing a regular sleep schedule, practicing relaxation techniques like deep breathing or progressive muscle relaxation, and avoiding stimulants like caffeine and electronic screens close to bedtime. Medical consultation. If sleep problems persist, it may be beneficial to consult a healthcare provider for a thorough diagnosis and targeted treatment, rather than self-medicating with alcohol. By being mindful of these guidelines and understanding the multifaceted impact of alcohol on sleep, you can make more informed choices for better sleep hygiene. Furthermore, moderation is vital. Dr. Iatridis recommends a limit of 2 drinks per night for males and 1 for females. It's essential not just to control the quantity, but also to allow ample time between the last drink and bedtime, ensuring the alcohol is metabolized and its effects have worn off by the time you're ready to sleep.